Good evening, and welcome to tonight's public hearing. This hearing will include Columbus City Council's Health and Human Services, Finance, and Workforce Development Committees. I am Councilmember Priscilla Tyson, Chair of the committees. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. Tonight's hearing is one in a series of bi-weekly committee hearings that I hold in order to review legislation in the committees that I chair. This includes Health and Human Services, Finance, and Workforce Development committees. The goal of the hearings is to promote transparency and to provide an opportunity for residents to learn and to speak on legislation that impacts their lives. There will be on occasions on which a committee is not covered because there's no legislation in that committee. The intent of each hearing is to review legislation that will be on the City Council agenda for the following 2 weeks. Tonight, we'll hear information on legislation in Health and Human Services and Finance committees. Legislation presented will be on the City Council's agenda for February 22nd. We have several speakers on the agenda. Office of the City Auditor, Deputy Auditor Bob McDaniel, Department of Finance and Management, Director Joe Lombardi, Columbus Public Health, Assistant Health Commissioner Roger Cloran, and the Department of Development, Director of Community Development, Hannah Jones. I will begin with the Legislation and the Finance Committee by asking Deputy Auditor Bob McDaniel to present. Bob, the floor is yours.
Thank you, Councilmember Tyson. The Auditor's Office has one ordinance tonight to bring before you. It's Ordinance 0288-2016. This ordinance authorizes the city auditor to make payments up to $10,693.30 to various auditor's office employees for vacation time and benefits which have been accumulated in excess of the maximum amount established by the Management Compensation Plan to authorize this expenditure out of the general fund. Basically, this ordinance is covering 4 different employees that were unable to use their vacation time due to the implementation of our new financial system. If I can answer any other questions, be more than glad to.
Thank you. And can you talk a little bit about the financial system that caused this to be able to, for us to be in the situation where we have to pay for excess vacation?
I can. I think with any implementation of any system, when you get down to the final hours, everybody has to be here, and these 4 employees were key to our office, and so I am glad that they chose not to take the time off, which was their right. Many of us have put in many hours just to get this system up and going, and I look forward to its continued success.
Thank you very much. I have no other questions. The next speaker will be Director Joe Lombardi. Good evening, Director.
Good evening. Thank you, President Pro Tem Tyson. We have 6 ordinances this evening for the Finance and Management section. The first ordinance is Ordinance 307-2016. This is to authorize the Finance and Management Director to enter into a contract for the option to purchase the secured removal and destruction or testing, sanitizing, and return services for used technology equipment on an as-needed basis with Southeastern Data. We are in an intergovernment agreement with SWACO. They opened bids on July 31st for this service. It is a 3-year contract that allows us to our commitment to recycle and dispose of city waste in an environmentally friendly manner. It allows us for security, to allow the prevention of security breaches and sensitive information. It is a 3-year agreement. This ordinance is just to set up that agreement.
Thank you. I don't have any questions about that. Thank you.
Next ordinance is 03-15-2016. It's to authorize the Finance and Management Director to enter into 2 contracts for the option to purchase mainline water service and repair parts with HD Supply Waterworks and Ferguson Waterworks, and to waive competitive bidding requirements of Chapter 329 and to authorize the expenditure of $2 to establish those contracts. The purchasing office solicited competitive bids in accordance with 329. There were 94 bids solicited and 2 bids were received. Bidders were asked to bid a discount from published catalogs that contain the line of parts needed, and specifications stated it was the city's intention to make multiple awards to maximize the selection of available discounts. At the time, the city had embarked on implementing a new e-catalog system purchased from Vinemaya. This system will allow city agencies to search for items needed and compare pricing to get their best value. A waiver of regulations is being submitted to award to multiple suppliers, as the code does not envision multiple awards for the same category. So that is the reason why we are waiving the competitive bidding requirements of the city code. If you have any questions, I'll be willing to answer.
No, I don't have any questions. Thank you.
Next ordinance is 319-2016. This is to authorize the Finance and Management Director to enter into one option contract for the purchase of installation and maintenance of trees with Custom Lawn Care and Landscaping, LLC, DBA Custom Landscape Contractors, for $1. This contract will be used to allow the city to replace trees that were lost to construction operation, insects, or disease in the city parklands, as well as to allow the reforestation of reservoir shorelines. The contract estimated cost will be $40,000, but this ordinance is only for $1 to set up that universal term contract. If there's any questions, I'll be willing to answer.
Yes, this contract, as you said, is just really for when we have construction operations and insects and disease. And I know that we, through recreation and parks, sometimes have the the legislation that comes to council for either the emerald ash borer or also to be able to put trees in, in neighborhoods. And so this is specifically for, not for those purposes, just strictly for, well, either construction operations, insects and disease in their city parklands, but not what Recs and Parks typically does.
That is correct.
Is that correct?
That is correct. But they could also use this contract if needed. If they needed any kind of help, they would be allowed to use this contract as well. But it is mostly for the parklands and the construction operation.
I'm happy that it's also for the reforestation of our reservoir shorelines and the natural areas.
Yes.
So I appreciate that. Thank you. We can go to the next one.
Next ordinance is 0355-2016. This is to authorize the Finance and Management Director to enter into a contract for the option to purchase powdered activated carbon with Cabot North Americas, Inc. And this is an expenditure of $1 to establish that contract. The purchasing office advertised and solicited competitive bids in accordance with 329 relating to competitive bidding. 113 bids were solicited, 5 bids were received. This contract will allow our water plants to use powder activated carbon in their process, which helps for the use of taste, odor control agents in the water that we produce at our plants.
So I know we had a hearing earlier on the water and the water safety, and so certainly this legislation is important to be able to make sure that our residents continue to have safe drinking water.
That is correct.
Thank you. And so the estimated expenditure, I know this is $2.3 million?
$2.3 million, that is correct.
All right. Thank you.
The next ordinance is 0388-2016. This is to authorize the Finance and Management Director to enter into a contract for the option to purchase swing pump parts with Columbus Lumber, doing business as Columbus Supply, and this is in the amount of $1 to establish that universal term contract. Swing pump parts are used primarily by the Division of Sewers and Drains for repair parts for the process of transporting dewatered sludge from the facility, dewatering buildings to the incinerator facilities at the plants. The proposed option contract is for 2 years, expiring in April of 2018, with the option to renew for 1 additional year with council approval and availability of funds. They were awarded all the items. They were a low bid on all the items through a competitive bid process. There was 89 vendors solicited and one bid was received. The total estimated annual expenditure for this contract is $200,000.
Thank you, Director.
0409-2016 is to authorize the expenditure of $990,754 from the Property Management Fund and $1,128,100 from the 2016 General Fund budget for payments to Paradigm Properties of Ohio, LLC, for building operating expenses at the Jerry Hammond Center and the Municipal Court Building. In January of 2012, the Real Estate Management Office issued an RFP for professional building management services for the Jerry Hammond Center located at 1111 East Broad Street and the Franklin County Municipal Court Building located at 375 South High Street to assist the city in properly maintaining and operating these buildings. The agreement provided for a 5-year term consisting of one initial 1-year term and then 4 consecutive 1-year renewals based upon approval by City Council and the availability of funds. This legislation authorizes the funding for the 4th and final consecutive 1-year renewal term for this agreement. If there's any questions, I can answer them.
No. I remember when we first bid this out in 2012. The total for this is $2,118,854. And again, we will be rebidding this next year, 2017, or at the end of this year for 17.
That is correct.
Okay. Thank you.
Yep. And our last ordinance is 0410-2016 to appropriate $124,000 within the Special Income Tax Fund for the Finance and Management Department Real Estate Management Office to authorize the Finance and Management Director to expend $124,000 or so much thereof that may be necessary for the Special Income Tax Fund for the payment of rent of office spaces. This ordinance is for the 50 West Town Street used by the Department of Development, and this is for to pay for those rental fees of the old Lazarus building. And this is our annual payment for the rent on that.
And certainly, the $124,000 is very important because it's used by the Department of Development. And we know how important the Department of Development is in terms of, especially the whole department is important, let me just say that. But the economic development is certainly the area in which we're constantly looking for businesses and to retain businesses and to bring businesses here so that we can continue to have those jobs that are critical for income tax, to pay the taxes to provide the services. So the $124,000 is certainly not a significant amount in comparison to the dollars that they work on each day to retain and bring businesses here. So thank you, Director.
And that's all we have for this evening. Thank you.
Thank you, Director Lombardi. The next speaker will be Roger Cloran from the Assistant Health Commissioner to discuss legislation from Columbus Public Health. Good evening.
Good evening, Pro Tem Tyson. Columbus Public Health has 9 ordinances tonight. Our first ordinance is 0238. We've been awarded a grant from the U.S. Department of Health and Human Services for the HIV Care Part A grant program for $4,010,911 for the period March 1st, 2016 through February 29th, 2017. The grant's purpose is to improve the medical care for persons living with HIV or AIDS in Central Ohio. It will pay for HIV-related doctor's visits, mental health services, substance abuse services, some oral health care, and other services available by the grant. It will also strengthen the case management and linkage to care. This year's grant award is level funding compared to last year's award. In the most recent grant period, we provided 1,300 primary or infectious disease medical care to patients, clients, and 1,800 received medical case management services.
Thank you, Roger. This is certainly an important grant for the City of Columbus. The $4 million is key. We know that we have in our community continue to see HIV and AIDS on the rise, and so to be able to achieve the viral suppression that individuals need to be able to have great quality of life, we need to have the relationships with these, we need to receive these dollars from U.S. Department of Health and Human Services to be able to make sure that everyone can live there a great quality of life, and this helps them to do that. So these are critical dollars for our community. So happy to get them. Thank you.
Next is Ordinance 0278. We've been awarded a $4,000 grant from the Greater Columbus Arts Council for the 2016 Art Walks project. This grant will be utilized to design and develop a near-south Art Walks map, update the 14 existing Art Walk maps, host 21 guided walks in each of the Columbus Art Walks districts, and continue to promote public engagement for all the Arts Walks in 2016.
Thank you. I know it's not a lot of money for this, the grant that we received. However, I know that these are a hit in our communities, to be able to look at the art, the architecture within the communities, and also it's an easy way to get healthy. So this is an important grant, and just appreciate GCAC providing those dollars to us. Thank you.
Our next ordinance is 0282. We've been awarded a grant from the Ohio Department of Transportation for the 2016 Safe Routes to School Grant Program. This will be for $60,000 for the period January 1st, 2016 through May 1st, 2017. The Safe Routes to School Grant Program encourages and enables children to walk or bike to school, positively impacting health, reducing traffic congestion, enhancing a sense of community, and improving safety. The grant this year will be utilized to implement the Columbus City Schools large school district travel plan and allow us to evaluate the Safe Routes to School programming efforts for effectiveness. This $60,000 award is the same as last year's amount.
Thank you.
Next is 0300. We received a award from the U.S. Department of Transportation through the Ohio Department of Health and the Ohio Department of Transportation. This is for $93,000 for the Ohio Buckles Buckeye Grant Program for the period November 16, 2015 through September 30th, 2017. This program provides low-income families access to child safety seats and facilitates car seat installation training within Central Ohio. In order to receive an Ohio Buckles Buckeye car seat, income-eligible families, such as families enrolled in the WIC program, must attend a 1-hour car seat class at Columbus Public Health. Last year, we were able to provide 600 families with car seats. And for more information, or if anyone is interested in signing up for a class, residents can call 645-7748.
Thank you, Roger. I'm smiling because you've given information to our residents, and I always like that. So make sure the residents can take advantage of our programs, and just really glad that 600 individuals were able to get car seats last year and keep their children safe. So thank you. This grant's really important to us.
Our next ordinance is 0295. We were awarded a grant from the Cardinal Health Foundation through the Columbus Foundation for the 2016 Healthy Children, Healthy Weights Grant Program. This is for $105,000 for the period January 1st, 2016 through December 31st, 2016. The Healthy Children, Healthy Weights Program is designed to prevent childhood overweight and obesity by promoting healthy weight and growth in all children. This grant will be utilized to partner with early learning centers, child care centers, and preschools in designated Cardinal Health Foundation target zip codes, and to provide practical strategies to establish environments and policies that promote healthy weight in children. We've had funds from them in the past, and these programs have provided and assisted over 1,500 children.
Thank you. Do you happen to know, if you don't know tonight, can let me know the targeted zip codes?
Yes, I do. They're in the near and far south, the zip codes 43203, 206, and 27. The Near East in 43203 and 205. Hilltop and Franklinton in 43215, 43204, 228, and 223. Wyland Park in 43201, and North and South Lindens in 43219, 211, and 43224.
Thank you for having that information. It's really critically important because those are many of the neighborhoods we're focused on with, many of the other programs where we see that we have some disparities in terms of in healthcare. And so I'm excited that Columbus Public Health has one submitted for this grant, but also focusing on those areas that we all know are critically important to every neighborhood being able for people to have healthy outcomes. And so and we have to be targeted. So and whenever we're getting dollars into our city, I think we have to be really targeted into those neighborhoods where we have such significant need. And I'm glad that this grant is doing that. So thank you.
All right, next ordinance is 0353. This is to enter into contract with Access Health Columbus, doing business as Healthcare Collaborative of Greater Columbus, and this is in the amount of $190,000. This contract will fund Celebrate One initiatives as recommended by the Greater Columbus Infant Mortality Task Force for the contract period February 23rd, 2016 through February 22nd, 2017.
Thank you.
Our next ordinance is 0386. Previously, Ordinance 2746-2015 authorized Board of Health to enter into a contract with Mount Carmel Hospital in the amount of $65,000 for the provision of participant coordination services for the Healthy Start Grant for the period ending October 31st, 2016. This ordinance is needed to increase this contract by an additional $32,500 for a total contract amount not to exceed $97,500. This will allow Mount Carmel to enroll and provide ongoing case management for at least 150 pregnant women by October 31st, 2016 in the Healthy Start program. Our Healthy Start program enables us to conduct care coordination in targeted area and neighborhoods of Franklin County, focusing primarily on perinatal and infant clients and their families. And the goal of the program is to improve perinatal delivery systems in the community.
Thank you. This is an important program for us, and appreciate this contract with Mount Carmel to assist. Thank you.
Our next ordinance is 0364-2016, and we are in need of specialized physician services for our STD clinic, and this ordinance will authorize us to contract with OSU Internal Medicine, LLC for physician services in the amount of $62,400 for the period February 1st, 2016 through January 31st, 2017. Last year, our staff and contractors were able to serve over 8,500 clients in our STD clinic.
8,500 clients?
I'm sorry?
8,500 clients?
8,500, yes. And finally, Ordinance 03...
Wait, certainly. We want people to come there. I know that sometimes we've been want to promote the services of Columbus Public Health and for the STD clinics, as opposed to going into the emergency rooms, to come to call Columbus Public Health and come there to be tested and get the care that you need.
Yes.
Thank you.
Finally, Ordinance 0378 is to authorize a purchase order with cribs for kids to provide portable cribs to ensure safe sleep environments for children of Franklin County in the amount not to exceed $36,795.40. This will allow us to distribute 460 portable cribs. In the last year and a half, we've distributed almost 1,000 cribs, and the public can call for more information if they feel they need portable cribs. They can call 311.
Thank you, Roger, for sharing the legislation this evening, and certainly a lot of it's focused on healthy women, healthy children, keeping kids safe in their car seats, and making sure they're sleeping in the proper bed. So this is wonderful legislation for our community. Thank you.
Thank you.
And our last and final speaker will be from the Department of Development, Ms. Hannah Jones.
Good evening, President Pro Tem Tyson. Tonight we have one ordinance for your consideration. It's Ordinance 0413-26. 2016, excuse me, is to allocate $117,000 from the Public Safety Fund to help support the work of Maryhaven and their Maryhaven Collaborative Outreach Team. I would like to invite James Alexander, who's the Executive Director of Homeless Programs at Maryhaven, as well as Steve Skavinsky up to talk about the program specifically. I do want to point out that this funding does leverage additional resources to fund the entire team for the fiscal year. And as they are coming up, are they coming up? Okay. I was like, I know I saw him here. I do want to take a moment, though, to publicly thank both Maryhaven and Steve specifically for their continued work and support of us in a number of endeavors. While not directly related to this funding, Steve has been supportive with the vacay at Oakland Manor as well as the extended stay hotels. So our continued ability to partner with Maryhaven is essential and important. So I want to thank them again for all of their help. Thanks.
Good evening. Just wanted to mention a few things about Maryhaven and the Maryhaven Collaborative Outreach Team. We're in a position where we're extremely honored to be able to work with folks in our community who are experiencing street homelessness. And so our target group is to work with people living in places not meant for habitation. So since January 1st, we've been able to support 37 people who were living in places not meant for habitation to move into shelter or housing. And of those 37, 23 of those have gone on to permanent housing destinations. We've been excited that 15 of those 23 went into the new Van Buren Village apartments, which has been phenomenal. We're currently working with about 100 people who are experiencing street homelessness. And through the Maryhaven Collaborative Outreach Team and our partners, we're really working hard to engage folks outside of the 100 that we currently are working with who are living outside. I was going to mention the two recent involvements in Oakland Park and in the Extended Stay Inn, where those were individuals who suddenly found themselves in a position where they were in a place not meant for habitation. So the role that we were able to play, we were thankful to be there for the families and the folks living there, having a presence at the Red Cross shelter and the apartment complex and the Extended Stay Inn. So that was really important for us to be there and support one family getting into the family shelter and then making sure they knew of additional resources. The last thing I just wanted to say was that mid-summer of 2015, I believe, before I came on board, the Maryhaven Collaborative Outreach Team had developed a hot list for people that we identified as the most vulnerable right now who are outside. And there were 8 people originally on that list, and at this point 5 of the 8 have obtained permanent housing. So what we're going to do, looking at best practices from other cities, is develop a comprehensive list of unsheltered individuals so that we can coordinate care as best as possible with all of our partners. And then through that list, we can kind of keep the hot list of the most vulnerable folks at the top of our radar to assist. So
tell me, to be at the top of the hot list, what are the kind of issues and concerns that you are seeing?
Sure. So our partners in behavioral health care and physical health care and the VA and transition age youth all kind of look at what are the barriers their folks experience. So it's chronic physical health needs, people struggling with addiction, mental health needs. So kind of looking at who are the folks that we encounter the most, who are the people going into the emergency room the most, who are the folks that we see physically in the greatest need.
Tell me what, just so for our viewing and listening audience, tell me what maybe is a typical day or an encounter with the individuals that you're referring to.
Sure. So we'll go out to the land where folks are staying at, introduce ourselves, make sure they know what resources are available, we're here to assist you, and kind of get a sense of what someone wants to work with us on. And some people are ready to work on housing right now, and we want to be ready to work with them right now. But then there are folks that it takes more time to build rapport. So we'll, ask them if we can return to see them where they're staying and kind of develop a follow-up plan. But just being accessible is extremely important to us.
The last question, since you mentioned you want to put together a comprehensive list because you're looking at some of the best practices that other cities have. Do you know any of those cities right now that have best practices in this area?
From what I can recall from a recent presentation, I know Houston was mentioned, New York, perhaps Denver. I can definitely provide you with more information. Yeah.
Well, Steve, thank you for coming down and
Thank you very
just
much.
and sharing your work with us. This is important work, and I know that as Ms. Hannah Jones just mentioned, that for the city, the appropriation that you're asking us is for the $117,000, but this program, the cost really to run it right now is $227,000. And we're looking to the help of the county to be able to put those additional funds in to support this outreach program, because it's certainly needed.
Great.
So, thank you. Is James going to come up and speak, or you're not? Okay, just want to make sure, give everybody an opportunity. Thank you. So thank you for your work.
We thank you for your support.
You're welcome.
Appreciate it.
Thank you. Okay, well, I hope this evening's hearing has provided insight into the programs and community initiatives from Columbus Public Health and the Development Department, as well as finance-related legislation that is necessary to support the city operations. As residents, these hearings are really an opportunity for you to learn and to become engaged in issues within the city. Before I conclude tonight's hearing, I want to thank Deputy Auditor Bob McDaniel, Finance Director Joe Lombardi, the Assistant Health Commissioner Roger Clorn, and the Director of Community Development, Ms. Hannah Jones. I also always want to thank my fellow council members and their staffs who serve our community each day with pride. I also want to thank City Council's Legislative Research Office, and the director is Mr. Michael Kessler, who is here tonight, who leads this team, and then Andrew Dwyer, who staffs the Health and Human Services and Workforce Development Committees, and Matt Erickson, who staffs the Finance Committee. I want to thank my staff, Nicole Harper and James Lewis, again, and the hardworking team of CTV will make these hearings possible, and finally the residents of the City of Columbus who make this city the best place to live, work, and to raise a family. Thank you so very much, and have a great evening.